Hey there, and welcome to Lunchtime Live at the Center. My name is Ami Choksi, and I am your host. Now, over half of all IVF cycles at the center involve pre-implantation genetic testing, specifically PGTA, which tests for chromosomal abnormalities. An additional 30 to 40 cycles per year involve PGTM, which is done for people who are at an increased risk of passing on a specific genetic condition. Now, for both of these screening tests, PGTA and PGTM, the embryo or embryos involved must be biopsied. So today we're talking with senior embryologist Caitlin Evans about embryo biopsy. Caitlin, hi, welcome.
Hi, how are you?
I'm well, thanks. Caitlin, what is embryo biopsy? What happens there?
So embryo biopsy is a method of testing an embryo for its genetic makeup. So we can find out things like how many, like you said, how many chromosomes there are. So if there's, any extra chromosomes or any missing chromosomes, it can pick up on that. It can tell us a little bit about chromosomal structural rearrangements that happen normally from balanced translocations and inversions, and it can tell us about the presence of any single gene mutations.
Okay, so when you're doing IVF, if you have the IVF steps, where does this fall? Where does embryo biopsy fall?
So now these days, so historically we were biopsying embryos on day 3 of embryo development, but now a very large majority of biopsy, it's almost exclusively blastocyst biopsy now. So on days 5, 6, and sometimes day 7
okay.
of embryo development.
So can you go through this IVF steps that lead to it? So the patient is stimulated and then eggs are retrieved, and then what happens?
So after the eggs are retrieved, we fertilize them on the day that they're retrieved. And that can either be done through ICSI or standard insemination. And then we grow them out. So we call that keeping them in culture. So we culture the embryos for 5 days.
Okay.
Well, either 5, 6, or even sometimes day 7. So 7 days they can be left in culture, and we check them on each of those days. So, for instance, like on day 5, we take the embryos out and we check them to see if they're ready for biopsy. And some of them might be ready that day, or some of them might be ready the next day, etc.
And can you talk a little bit about the parts of the embryo itself, and what part do you actually biopsy?
Of the blastocyst?
Right.
So there's 3 main parts to a blastocyst. There's the trophectoderm, which is the outermost portion of cells. And then there's the blastocele or cavity, which is just the fluid-filled middle part. And within that cavity, so the trophectoderm surrounds the cavity, and then within that cavity, there's what we call an inner cell mass. And that's just like a solid mass of cells that will eventually become the developing fetus. The trophectoderm on the outside is the part that has to implant, and that will form the placenta and the end membranes.
So what specifically do you, which part of the blastocyst do you biopsy?
So we're only able to biopsy the trophectoderm. We can't touch the inner cell mass because that's the part that, will eventually become the baby if implantation occurs. So we just take a few cells from the trophectoderm, and they're at the blastocyst stage, the embryo is made up of hundreds of cells. So taking, 3 to 8 cells doesn't harm the embryo at all.
So why don't you do the inner cell mass, or why don't you do a different part of?
So the inner cell mass, we don't touch the inner cell mass because that's the part that, first of all, it's a harder thing to biopsy because it's like a solid mass of cells.
Okay.
Whereas on the trophectoderm, you can see the individual cells. They look like little scallops almost. Oh, cool. So we don't touch the inner cell mass because that's the part that could potentially become the baby. So we just take from the part, the placental part.
Okay. So you had said, so it could be either day 5, day 6, or 7. How do you know when it's ready for biopsy?
So the embryos have, when they start reaching the blastocyst stage, they slowly start to develop. Like you can sometimes see, like on earlier embryos, like a cavity starting to form. But we can't. First of all, we have to know the location of the inner cell mass before we can biopsy the embryo, because we want to biopsy as far away from the inner cell mass as we can, because we don't want to disrupt that in any way. So earlier embryos, we can't biopsy. And then the embryo has to be a certain quality. So it has to be a nice embryo, a nice blastocyst, because it has to be able to survive a subsequent freeze and thaw cycle. So if the embryo is too fragile, or there's degenerative areas, or it's just not, it has to be a certain quality for us to be able to do it.
How can you tell what the quality, how do you tell that quality?
By looking at lots and lots and lots of embryos.
Okay. Lots of experience.
Yeah. When you look at embryos as often as embryologists look at embryos, you know good quality versus poor quality.
Got it.
And early versus expanded, etc. So.
And you said the position of the inner cell matters as well, correct? That's something I haven't heard about before. So can you talk a little bit about that?
Well, it doesn't matter in so much like where, it matters because we need to know where it is before we're going to get in there with a biopsy pipette and a laser and take cells away from the embryo.
Okay. So you're talking about some of the materials. What is going on at your station in the lab when you are biopsying? So
biopsy is one of the more complex procedures that embryologists do. I might argue it's the most, but I guess you have to ask embryologists that. But we have a microscope, and it sits on an anti-vibration table, so you don't get any movement from anybody walking by or anything. And then you have on the left side, there's what's called a holding tool, and it just uses like a little bit of air suction to hold the embryo in place.
Wow.
And then on the right-hand side, you have your biopsy pipette, and that's attached to an aspirator. So you pull up like a little clump of the trifectoderm cells into your biopsy pipette. Again, it's just air suction. And then we use a laser to cut the cells. Like you can see their junctions. So we try to cut the cells at their junctions. And then once we get to a point where at one point we can like just pull the little clump away from the trifectoderm, and it doesn't harm anything.
That's impressive technology.
Mm-hmm.
So we do the biopsy in our lab. Do we do the testing once the embryo is biopsied as well?
No. So you have your embryo, and then you have your tiny little clump of cells. That little biopsy piece, we call it, the little clump of cells, we put into a little microcentrifuge tube, and we freeze it. It's in a very small amount of media, and we freeze it, and then we send it just in the mail, basically. FedEx actually picks it up. We send it to a reference lab, and they run the test. So, and then we freeze the embryo, and we keep it here at CARS.
Now, is there ever a time in the process where you're doing a biopsy, but for some reason you realize that it's, your team decides not to continue? I mean, has that ever occurred?
Not so much. Usually we can just determine, whether it's going to be biopsy just by, we do what's called embryo checks every day. So, just by at that particular patient's embryo check, we decide whether we want to biopsy it or not. But sometimes we'll look at something in the morning and be like, that's a little early, but I think it might be ready this afternoon. Then we'll look at it again in the afternoon and do it then.
Okay. And is there any difference? There's PGTA, there's PGTM. Is there any difference in what you do as it relates to the test that will be happening?
No.
Okay.
It's the same process for. The only difference is on occasion for certain single gene disorders, they'll ask us to send arrested whole embryos. So embryos that are arrested like day 3 and they don't make it to the blastocyst stage, they'll ask us to send those with the cells that we biopsy so they can create a better genetic profile for the parents.
Okay. How do you determine?
It helps them just diagnose the embryos better.
Okay. When you're doing the biopsy, how do you determine which cell or cells to pick?
It really has a lot to do with the location of the inner cell mass. So like I said, we want to biopsy as far away from that as we can. So we can orientate the embryo on the holder to make sure that we're far away from the inner cell mass when we go to biopsy.
Okay. And does a biopsy always have the cells you need?
Yes and no. Sometimes we get what's called a no result on embryos. And that just means, either the cells we had were not sufficient enough for them to run the test and decide if the embryo is normal or abnormal. But we still have that embryo frozen, so we can retest it. We can thaw it and rebiopsy it and freeze it again. So.
Okay. And when you do a biopsy, you had mentioned this briefly, but is any part of this future baby harmed?
No, it's totally safe.
Okay. And I'm sure that's a question that people consider or think about. How do you keep track of the embryos you biopsy?
So we do single embryo culture here at CARS. So from day 1, they're all assigned a number and they all are in their own little drops. So we know like which embryo is which. So we just keep that, when there's a lot of numbering involved. So like when you sit down to put your embryo in the biopsy dish, you have them all numbered and they all go in separate drops at all times, and there's no mixing of anything. So. Okay.
So you can match the PGT results to each specific embryo.
Yep. It's a lot of numbering.
Okay. Anything else that we should know about with regards to embryo biopsy that you think we haven't covered, perhaps?
I don't think so. It's a really great technology, and it's amazing what embryos can tell us just from, simple procedures like number of chromosomes.
It's amazing. It's terrific technology. It's so amazing.
Yeah.
All right, Caitlin, this has been really interesting. So thank you for sharing today. And be sure to check out our website at yukonfertility.com for any additional information, as well as the calendar events. And we will see you next time on Lunchtime Live next week, to be specific. Bye now.
Bye. Thank you.